See, now we got to know that counseling is very effective in helping the person to come out of the habit, and their family also will have a better health in future. But are there any other effective medications which we can give adjuvant to these things when they want to quit a habit?
See, there are a lot of medications. We have inhaling anti-nicotine. So how medication happens is, like I told you, there are nicotine receptors in the brain, in the neural.
Yes.
So what these medicines do is they block those neuroreceptors, those nicotine receptors. So after a while, maybe 15, 20 days, 30 days after taking the medication or having quit, when the person decides to smoke, there those receptors are already blocked by the medicines. So even if the person is consuming tobacco, even if the person is smoking, they will get that hit that they used to get from from smoking earlier. So inadvertently they are since they don't like smoking anymore, they're going to quit. So that is how the medicine works. So now it is very important to what kind of medicine, what kind of dose we need to give that person. For example, we have nicotine chewing gums also that we give to people who are in the habit of chewing tobacco because they want to keep something in them. Then the correct way to use that chewing gum is you chew it for a while, it starts to release a peppery taste, then you park it somewhere in the mouth wherever you used to chew tobacco, wherever you used to keep tobacco, and then leave it for half an hour to 1 hour. Then after an hour, when you want to smoke, when you want to chew tobacco again, then you again bite it a little. Then again that peppery taste comes out, and then you continue. Then for smokers, what happens is we give an inhaler because in smoking, along with the actual nicotine, they have a habit of using the fingers and using their mouth. So when they use an inhaler, that kind of mimics their action of smoking.
Okay.
It's very different for each and every individual, as I said, along with the, once during the counseling, we find out what the habits are. Only then we are able to actually advise the dosage and the method of medication. Then there are nicotine patches also. That also, that has a completely different indication for patients.
So you are saying that there are effective medications and treatments are available, but if the person is willing to quit the habit and he follow all our instructions along with the counseling, it is going to definitely work. But how effective are these patches and the chewing gums?
These are quite effective, sir. Only, as I said, only when you haven't had a cigarette or your tobacco for 10 to 15 days at least. Because continuing it, these medicines are not going to work. Because what happens is, as I said, they attach to the receptors. If they're getting the actual nicotine, then the receptors won't allow the medication to act. It's when they are not getting the nicotine, they are like, chalo, we're getting something related to nicotine, let's accept it. So that's how it gets blocked. So again, even if we are giving medication, the willpower of not chewing tobacco or not smoking for 10-15 days, that is what is of main importance. And that is where a lot of people, they fail because they start taking the medicines, smoking while they are consuming tobacco, and they end up saying that, oh, I tried the medication, it didn't work. But you have to take it in a particular way. And for that, you need to go to a counselor.
Correct. So now it is evident that yes, if at all somebody wants to quit a habit and they want to become healthy, there are methods and